Hello, my name is Grace Reese. I am an 8th semester nursing student, and today I will be demonstrating how to explain chest tube care and maintenance to a patient. I'm going to say my patient today is Mr. Smith, and he just came out of surgery, and I am explaining to him what we're assessing, what we're looking for in terms of assessing his drainage and his progress with his chest tube. Mr. Smith, hi, my name is Grace. I'm going to be your nurse today. You just came out of surgery. You have something called a chest tube in, and I know it causes you some discomfort, so we do have some medications here for you. There are a couple different kinds of chest tubes. Some are mediastinal, which are more on the center of your chest, but you have a pleural chest tube, so it's going to be on your side here. And the reason you have that, we did discuss with you pre-surgically, but just reminder, you have an infection in your lungs. It's called empyema. Empyema is an infection that causes pus to accumulate. So you just have some infection accumulated in your pleural space, and we do need to remove that so that with your chest tube, so that it does not collapse your lung. So we have your chest tube here, and this part would be in my patient. You'll notice, Mr. Smith, that it does have a few sutures holding that in place. You should have this chest tube for about 2 to 3 days. Not everyone is the same. It will be up to your surgeon to decide when to remove that. It'll be based on the x-ray to see whether your fluid is, your pleural space no longer has that infection in it. We decided that you were a candidate for this chest tube based on an assessment of your respiratory health, your age and overall health, your cognitive level, and our x-ray and CT findings. The next few days while you have this chest tube, Mr. Smith, we're going to be in your room a lot. So we're going to be assessing your respiratory rate, your vital signs, and your pain level a lot. We are aware this can be very uncomfortable for you, and we do want to help you manage that because it is extremely important that you cough and deep breathe, and we use your incentive spirometer at least once an hour, and that is to prevent infection from settling in your lungs. And so we will be doing that frequently with you as well. So you're going to notice us writing on your chest tube a lot, and that is because this column right here is a collection chamber. We do measure the amount of drainage that we get, and we do mark and initial it. We never actually throw, or we never actually empty this. When this is full, we will just throw this away. That would be a 2-person job, and you'll notice that we do clamp that in between changing it. Please do use caution when standing or getting up. Not only will you be in some pain and on some pain medication for that, but this tube is very easy to trip over, and if you pull it out, it will be uncomfortable for you. We will have to put it back in. So I just wanted to talk to you a little bit about what this means. You have a water chamber here. It has 2 centimeters of water in it, which is exactly the amount that we want. And what we're watching this water for is it's going to do something called tidling. So it's going to move slightly, sway with your breathing. It may move more if you're coughing a lot, and that's understandable. But what we don't want is we don't want air bubbles, and we don't want heavy movement in there. It does indicate an air leak or could indicate respiratory distress for you as well. This suction, you have a dry suction, and so we can monitor the amount of suction going on there. And then we also don't want to see bubbling because it does, the air leak can be an emergency, and I would need to let the provider know right away if we did see that. When we are done with this chest tube, the surgeon will come remove it, and we do put that in a biohazard bag, and I'll put that in the dirty laundry room. You'll notice you have a dressing over it right now. We will be in to change that periodically over the time you have your chest tube, and it has something called a Vaseline gauze on there, so it's kind of like a heavy, sticky protective, because we really don't want anything getting right into the space of your lungs. And then we do have tape over that, and that helps hold it in place as well. So whenever we change that, I'll probably have somebody helping me with that as well. So just to reiterate a few things, this is going to measure the drainage of infection. You're going to have it for a few days, and the surgeon will take it out. And once we get a good x-ray, please call us if you're having pain, If you need to get up, if you have any shortness of breath, we would be happy to help you. And let us know any questions that you have, because we would be happy to help educate you about this healing process. Thank you.